How can you screen for ulcers without an endoscopy? Imagine feeling persistent stomach discomfort and wondering if you might have an ulcer. While endoscopy is the most accurate way to diagnose ulcers directly, there are several reliable non-invasive methods to screen for the underlying causes, especially Helicobacter pylori infection, which is a common culprit. These methods are often used first because they are safer, more comfortable, and easier to perform. One of the most dependable tests is the urea breath test. This test involves swallowing a capsule, liquid, or pudding containing urea labeled with a special carbon atom. If H. pylori bacteria are present in your stomach, they break down the urea into carbon dioxide. After a few minutes, you breathe into a container, and the lab analyzes your breath for the labeled carbon. The urea breath test has a high accuracy rate, with sensitivity and specificity often above 90%. It is safe, quick, and suitable for adults, children, and even pregnant women in some cases. Blood tests are another option. These tests look for antibodies against H. pylori in your blood. If antibodies are present, it suggests you have been exposed to the bacteria. However, because antibodies can remain even after the infection clears, blood tests are better for initial screening rather than confirming active infection. They are convenient and provide quick results, but they cannot distinguish between current and past infections. Stool antigen tests are also widely used. They detect H. pylori antigens in a stool sample using special antibodies. These tests are highly accurate, with sensitivity and specificity above 90%. You simply collect a small stool sample in a provided container and send it to a lab for analysis. This method is non-invasive, straightforward, and useful for both initial diagnosis and checking if treatment has been successful. In some cases, imaging tests like an upper gastrointestinal series can help. This involves swallowing a chalky liquid called barium, which coats your stomach and intestines. X-rays then reveal the shape and size of your stomach and can sometimes show ulcers. While helpful, this method is less sensitive than endoscopy for detecting small ulcers or inflammation. Your healthcare provider may also perform a physical exam, checking your abdomen for tenderness, swelling, or abnormal sounds. While this alone cannot confirm an ulcer, it helps guide further testing. Choosing the right screening method depends on your preferences, symptoms, and risk factors. Non-invasive tests like the urea breath test or stool antigen test are often preferred because they are comfortable and easy to repeat. Blood tests are quick but less specific for active infection. Keep in mind that these tests detect infection but do not visualize the ulcer itself or assess for complications. If you experience severe symptoms such as vomiting blood, dark stools, intense abdominal pain, or unexplained weight loss, your doctor will likely recommend an endoscopy. This procedure allows direct visualization of the stomach lining, assessment of ulcer severity, and the ability to treat bleeding or other issues right then and there. Always remember, screening is just one part of managing your health. If you suspect an ulcer or have ongoing symptoms, consult your healthcare professional. They can help determine the best diagnostic approach tailored to your individual situation, ensuring you get the most accurate diagnosis and effective treatment plan.